Knee pain can be extremely frustrating and really limit you, but you don't have to live with it. You might want to consider physical therapy. Dr. Michael Gilbert, owner of Gilbert Physical Therapy, is here with how he could help ease that knee pain for you. Welcome, welcome, welcome.
Well, thank you. I'm glad to be here.
Yes, you're helping us. You're back again, and this is
Yes.
so great because so many of us are in different kinds of pain. So we're talking about knee pain today. What are some of the most common forms of that?
Well, some of the most common forms of knee pain that we'll see in our clinic are by far and away arthritis is the most common. It is the natural wear and tear of the joint and can be from muscle weakness or from a flexibility deficit or what we simply do through life.
Sure.
Secondly, we'll also see ligament damage. This will come from, we've all known someone who's played a sport or we've seen it on TV where one of the ligaments in the knee will tear, and the ligaments are what keep our knees structurally sound. There's also what's known as patellofemoral syndrome, and this is, the patella is the kneecap. This is where pain can be located on the front of the knee, which is generally right on the front, and that can come from muscle weakness, it can come from flexibility deficits. It's one of the things that we would help people solve. Another thing is there is a structure in the knee called the meniscus. The meniscus acts as a shock absorber as well as ensuring extra contact surface in the knee, and it can tear. Now, the last thing is just simply generalized muscle weakness and flexibility deficits that may create a generalized knee pain.
Okay, so gosh, so many reasons we can have this pain.
Absolutely.
How can physical therapy help us relieve that?
Well, physical therapy helps to get to the root of the problem. And let's take two examples, for instance. One will be patellofemoral syndrome. So this is where the kneecap on the knee contract abnormally. And if we look at the kneecap's located on the front and it sits within a certain groove.
Okay.
If you have a muscle weakness or a flexibility deficit, you will actually have the kneecap slide and track abnormally, which can cause an abnormal pain, pressure, and cause you to either run abnormally or walk differently. Secondly, we can look at arthritis. Now, arthritis as a big cause is going to come from the inside of the knee. And if we pull it back, we can see the ligaments on the inside and then what are called the condyles.
Okay.
The condyles are where arthritis would occur at. These are the areas that will typically get worn down. They will become brittle. They will start to bleed within the joint. And this is also the area that when folks have a total knee replacement, that is the area that is replaced. These two areas as well as the top portion here.
We want to make sure we get in today that you have an event coming up that could really benefit a lot of people. What is that?
So we're going to have a workshop coming up on November 14th. This is going to be for neck pain and arthritis, like with the knee, and we'll be talking a little bit about each area. It is open to anyone who would like to come. It is from 5:30 to 6:30. All that we ask is that you call our office. Our receptionist will register you for that event, and then we will be able to get you scheduled.
And there's where your office is. There's the phone number. Also a great website with lots of information. Dr. Gilbert, thank you for being here and helping us ease those aches that we live with every day, but we really don't have to.
Thank you very much. Glad to be here.